It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Kalei-Suji on the digital platforms of the Honolulu Star-Advertiser.
Aloha and thanks for joining us here on this Wednesday morning. I'm Ryan Kalei-Suji, joined by Yanji Denise, and this is Spotlight Hawaii, of course, on the digital platforms of the Honolulu Star-Advertiser. This morning, we focus in on a very important service and a group of individuals in our community who do so much, often go unnoticed.
Yeah, that's right. The mayor has declared this Emergency Services Week. And so in honor of that declaration, we are welcoming Honolulu Emergency Medical Services Director, Dr. Jim Ireland, who heads up EMS. Thank you so much for being with us this morning, Doctor.
Thank you.
So, we want to talk about some of the challenges your department is facing, but overall, your department has been through so much. We've been talking to you for years now on this program throughout the pandemic. How do you think things are going for EMS?
I think it's an exciting time to be in EMS, but it's also a very challenging time. I got into EMS in the 1980s. I began working on a city ambulance in the 1990s. But things are different now. The call volume's up. Cell phones have allowed, more access to EMS. I don't know if you guys are old enough, but when I was first driving, if you saw an emergency on the street or a car accident, you had to drive somewhere to make a phone call. You had to go to a payphone and find a payphone, make the phone call. Well, now with cell phones, people can call 911 really instantaneously. And they call for a lot of different stuff that maybe they didn't call for when I first got into EMS. So, the call volume every year just keeps going up and up and up. And that's part of the challenge for our crews, not only to provide, emergency life-saving treatment, on a daily basis, but also keeping up with the volume of calls. And some rigs in town are just kind of going on call after call after call. So as administrators, our challenge is to, advocate for them to get the funding and the supplies and the ambulances they need so they can do their job. So it's just a busy time, but it's also an exciting time. I think a lot of us, EMS led the way in the COVID response, at least in the pre-hospital setting and taking care of people. And I'm glad, that's mostly behind us now. We still are going on COVID calls, but nothing like before, the vaccine being available. So, that was a real test for, I think, EMS and all of healthcare, really all of society. But, personally, I'm glad that's mostly behind us.
One of the things as you talk about some of the challenges, and we've talked on this program before, and not only with you, but with people in other sectors of our community, and that's just the labor and workforce. Talk about the staffing supplies that you have. Is there a continued need for EMS workers, and how is that maybe impacting the services that you're able to provide right now, given the volume that you're seeing based also on the level of staffing that you currently have?
Yeah, let me talk about that, but I'm going to move out of the way of the camera real quick, and I'm going to try to show you something. I don't know if this is going to come up, but this is an ashtray, and this is from 1970, so you can tell that obviously we don't use ashtrays to promote EMS anymore. But this is a 1970 commemorative ashtray from the city and county of Honolulu, marking 50 years of EMS service or ambulance service. And what this is saying is ambulance service in the city and county of Honolulu started in 1920. So now we're 103 years in. But ambulance service in its infancy in Honolulu anyway was a police department that had the ambulance. The city and county health department started running ambulances from about the 1940s up until this day. Now we changed the name from ambulance division to EMS division. We changed the name from health department to emergency services department. But ambulance service has been around for 100 years in Honolulu. But really advanced life support, where paramedics did skills that could only previously be done by doctors, shocking the heart, giving drugs, intubating the lungs, putting breathing tubes in, putting people on ventilators. That was with the birth of paramedics in the 1970s, early 70s. And Honolulu had one of the first paramedic programs in the United States, along with Los Angeles and Miami, dramatized by the show Emergency, also in the 70s. So we've had paramedics now for about 50 years. But if you wanted to be a paramedic today, like just say, that's what I want to do in life, there's a process, and that process is about 4 years. We have hired people directly at the city, and then we put them through EMT school. KCC also has an EMT program where I went through, and most of our employees actually went through the KCC program, where you get a license to become an emergency medical technician. You can work on an ambulance, you can do basic life support. Then after anywhere from 1 to 3 years of job experience, you can go on to paramedic school. And paramedic school is also at KCC. If you're a city employee, we pay you to go to school as a full-time city employee, but that's another year. So you can see from the time that you wanted to get into this field, and not even including prerequisites to get into EMT school, the process is 4 or 5 years. So paramedics are highly trained, highly skilled, and it's a really stressful job. And many people get in it and they stay in it for a career. It's a passion. They love it. They can never see doing anything else. But other people, it's not for them. And they move on to non-healthcare fields and other healthcare fields. For instance, nursing. Some go on even to the fire department as well. So we do have a constant need to bring new people in, but also to expand the service, because like I mentioned, call volume keeps going up every year. It's up about 20% now compared to pre-COVID. And so we're always looking at ways to fill our ranks. And we have an academy starting in July. It's a city EMS academy for EMTs. We're partnering with KCC. We have about around 40 to 45 people slated to start in July. And that's to fill 25 vacancies. So we feel by the end of the year, we will be robust with our staffing. And on top of our own academy, we're still hiring people who are graduating from KCC. We're hoping to bring on another 10 or 15 people that have already completed their training at KCC. But again, because this job isn't for everybody, it's hard, it's stressful, nights and weekends, we're constantly looking for good people to come work with us.
You know, you mentioned call volume being up 20% since pre-COVID. Can you tell us a little bit about the nature of the calls that you're seeing? I would imagine there are some things that are typical, but what's unusual? What's driving up all of these calls?
Well, for one thing, I'm thinking a lot of people didn't get the kind of healthcare they got during COVID as they did at any other time in their life. And what I mean by that is maybe they couldn't get in to see their care providers. Maybe some of their stuff was done by video, and some people just didn't go to things. They didn't get screening colonoscopies. They didn't get mammograms. And so I think overall that takes a toll when you miss things like that. And our calls for what you call the ordinary calls, like heart attacks and strokes, high blood pressure, diabetes, not that they're ordinary, but those are common calls. They're still emergencies. That call volume was up. Now you couple that with the tourists are back, and everybody's having fun, which is good, but people are hiking more. There's rescues daily for injured hikers, pretty much. People are going into the ocean more. There's calls in the ocean. There's still calls for COVID. We're still going on calls for people infected with COVID. Not a lot of calls. That's adding to the call volume. And then unfortunately, we're seeing more calls for overdoses, including fentanyl, which is here in Hawaii now. And sometimes, 1 or 2 calls a day for just fentanyl overdoses. And then we're also seeing an increase of calls for self-harm or suicide attempts, which is really, really concerning for me, because I think that shows people are hurting in our population, or they feel helpless where they're doing things to hurt themselves, and we're responding to those calls as well.
Yeah, let's focus a little more about that. Unfortunately, that is a statistic that we're seeing. Maybe if you can compare and contrast how much more that you're seeing with those self-harm calls that you had to report on. And if you can expand more about fentanyl and its presence overall here on the island of Oahu.
Sure. So with respect to self-harm, I don't have an explanation for it. I have some guesses. I'm not an expert in this field. And I really think the mental health experts need to engage with the media and the community on ways people can get help. Data from the medical examiner, people who've committed suicide, there's some delay in that. That's always, what happened last month or what happened last year. And that's for people who've actually taken their own lives. But for people who attempt suicide, that data is a little harder to get because, they may go to different hospitals. Poison control only has so much data. But I'm able to review our call volume data, our CAD data. CAD is the computer assisted dispatch when someone makes a 911 call, to see what kind of call we're going on. And I just noticed that, instead of maybe 1 or 2 overdoses a day, we'd be going on 5 overdoses a day. And there was one I counted 15. And again, 15 is not common, but I mean, it was kind of spiking up to that point on certain days. And I looked at what people were overdosing on, and it was things like over-the-counter medications, their own medications, illegal narcotics. Somebody took 100 gummies, and that probably wouldn't kill you, but that was a gesture on that they were trying to hurt themselves, and I think a cry for help. So I just started noticing all these calls. So then I kind of just started counting them informally, and to be honest, it was alarming. And it was young people. As I saw one in last week as young as 14. And so people are hurting out there. I don't know why. EMS is responding to the calls. They're taking great care of people. They're saving people. But really, I think we need, at some point, the mental health experts to weigh in and give folks an avenue to get the help that they don't feel they have to do this. With respect to fentanyl, I can answer that, but do you have a follow-up on just
Oh, no,
this?
please go ahead. Please go ahead.
Yeah, and fentanyl, again, we know there's drug use in our communities. People, this is nothing new. People use methamphetamine, cocaine, narcotics. And narcotics are things like heroin and regular pain medications like oxycodone, OxyContin. Fentanyl is actually carried on the ambulances and in hospitals. It's a liquid. It's a very powerful narcotic to control pain or before or after surgery. But it's been manufactured in clandestine labs internationally in a powder form. People don't know what dose they're getting. A lot of times, I bet you they don't even know they're getting fentanyl. It's being disguised as other narcotics like oxycodone or OxyContin. The good news about the fentanyl, if there is any good news, is it can be reversed with naloxone or Narcan, which is available over the counter. People can get it free. And if people do know somebody, friends or family, who are using narcotics, they can use the Narcan to revive them. Now, we carry that on the ambulances. We're using it pretty much every day for something, and it will reverse the effects of Narcan if we get to it'll reverse the effects of narcotics, fentanyl in particular, if we get to them in time. The council now is considering a bill to require it in bars. That'll be heard later today in one of the committees, because we know where people are, quote, partying, they may be using things like fentanyl. So I think, again, community awareness is important, that you can save someone before EMS gets there if you have the Narcan. On that note, we are now seeing on Oahu evidence that fentanyl is being cut with a drug called Xylazine, which is a horse tranquilizer, street name of Trank. But now we have that on Oahu. So we're going to be educating our paramedics on medical response to that medication, that drug, which does not get reversed with Narcan. So the point being, just all these types of calls or emergencies paramedics are trained to go to, we respond to daily. And to be honest, just being affiliated with them, being in this department, I'm just so proud of all the work they're doing, whether it's EMS week or not, because for them, it's every week's the same. But they're just doing such a tremendous job to take care of our community. That's the fuel for me to come in and advocate for them every day.
Can you talk a little bit more about the Xylazine? I'm not familiar with this narcotic. How concerned are you about it? How lethal is it? Where are you seeing it? What population, specifically do you see it? Is it a party drug? Or where do you see this right now? And how concerned are you about its infiltration into our community?
Well, I think the biggest concern I have is people don't even know they're taking it. And I don't even know when they're taking the drug that turns out to be fentanyl. I don't know even if they know they're taking fentanyl, because maybe they think it's some other narcotic. But it started out of Puerto Rico, and it is a horse tranquilizer. And it's used by veterinarians to put horses to sleep for when they need to do procedures and surgeries on horses. So obviously very powerful, but it has infiltrated into the, it is cut with, they cut fentanyl with it. It's been well described in Philadelphia and some other major U.S. cities. We've had some now noted in Kona, but I know now for sure it's here on Oahu. And we've had some overdoses recently where that was detected. It was involved. So there's no doubt it's here on Oahu. The treatment is different for an overdose of Trank than it is for fentanyl. So I think our paramedics and later the hospitals are going to need to be aware of this, to incorporate that into their treatment algorithms, because again, Narcan will not wake you up from an overdose of Xylazine. It's a completely different treatment algorithm, and it's a more supportive care. There is no specific antidote. So I guess getting back to my biggest concern is I just don't know if people know what they're taking. And I'm sure of it, because some of the overdoses where I've talked to the victims afterwards, after they've awoken from the Narcan, at least in half a dozen cases, they thought they were doing cocaine. They were, snorting it intranasally, and it ended up being fentanyl, and at least in one case, fentanyl and xylazine, and they didn't know, they didn't even know what they were taking. So it is concerning. The other thing xylazine does is it causes a characteristic sore or wound when it's injected in the skin. And some people kind of informally I've talked to that are drug counselors have been seeing more of these types of wounds on Oahu. Still don't know if it's related to the xylazine or not, but there's a suspicion there.
One of the other things that you mentioned that you're seeing an uptick in is just hiking rescues and those assistance that you're having to provide for maybe visitors as well as locals, excuse me, who find themselves endangered, maybe when on a hike. There has been some debate and discussion over whether or not to charge individuals that may be on an illegal hike or going into an area that has really been off limits, but thus they get into some trouble and EMS is called in to help. Your thoughts on whether or not there should be some sort of rescue fee or some kind of charge for those individuals who require assistance that go beyond and in an area that may be considered off limits?
Right. And I really think that's more of a discussion for the fire department. But from my standpoint, if we gave an extra charge for everybody who made a bad decision, the EMS would be fat with money, because, all day long, and especially with alcohol and at night and people, getting into scraps, we go to calls all day long resulting from bad decisions. But when it's specific to hiking, I think the debate might be illegal trails versus sanctioned trails. The vast majority of the rescues are on legal and sanctioned trails. It's just folks maybe that don't realize their limitations. Maybe they're not in as good a shape as they think they are. Fortunately, fatal injuries are rare. One is too many, but we still do see those. From the EMS standpoint, if we take you to the hospital, everybody gets a bill. So if we respond to a hiking emergency, we take you to the hospital, we're going to give you a bill, just like if you were in a car accident or fell down or had, chest pain. Everybody in EMS who's taken to the hospital is given a bill. So for us, it's not so much of whether you're going to get the bill or not, because we do that. One of the things EMS is thinking about, that we are still, having some internal discussions about this, is should we give a bill to people that we go take care of, but we don't take to the hospital? Because right now, if we go to a car accident, we check people out, we put a splint on, but people drive themselves to the hospital. Honolulu EMS does not give a bill for that. And so one of the things we're talking about is we do give medications, or we do some splinting or do some sort of treatment in the future. Should we give a bill for that? Because right now we don't. And again, that's still something we're discussing internally. But that could be applied potentially to rescues. If EMS went, we checked them out after the rescue, but they didn't go to the hospital, potentially EMS could give them a bill. But again, we're still discussing that. And again, just to emphasize, when I look at the rescues across the island, it's really the fire department who's going to all of these. And if there's an injury, then EMS will go as well. But the vast majority are actually at Diamond Head and Cocoa Head, which aren't particularly dangerous. But I think those are the ones where, especially visitors, don't realize maybe how difficult it is to hike up, that many stairs. Some of the other trails along the Ko'olaus are maybe more where people get lost or have things like sprained ankles or falls where they get injured. And that happens. And then, of course, you have illegal trails like the Stairway to Heaven in Kaneohe. The other thing, though, that really most concerns me is what we can do to prevent fatal injuries and fatal falls. And we've been working with a group here internally to discuss that as well. What kind of public messaging or signage could potentially help people, avoid fatal accidents on some of our trails.
I want to ask you about resources. We know that there are 22 rigs that cover the island of Oahu, which I'm sure you can always use more. And the council, of course, is considering the mayor's budget. Can you talk about where you'd like to see more rigs in our community and what kind of a difference that could make for the community and for your staff?
I think we really need to get about 30 ambulances on Oahu. Now, our 22 are supplemented. There's the private ambulance service, American Medical Response, who on any given day maybe has about 10 ambulances in service, plus or minus, as well as the federal fire department. And we have agreements with both of those entities that if they need help, we'll help them. And if we need help, they help us. So our 22 can expand, especially if there was ever a major incident. We could call on those partners to help us. But the city probably needs to run about 30 ambulances total within the next maybe 5 years to get caught up to the call volume. The biggest need right now is definitely in town. And by town, I mean from the airport to Kahala. And that's why we're proposing in our budget Kalihi and Kaka'ako to add to that town response. But when I look around the island, Makaha probably needs an ambulance, maybe one in the Ko'olina area, Sunset Beach, Waikane, probably one more in maybe the Kailua area, one more somewhere between Hawaii Kai and Kaimuki, and then again, a few more in town. So we definitely need more ambulances. Our goal is to add 1 or 2 a year for the next 5 years. And even if it's just peak hour ambulances. So for the ones proposed in Kalihi and Kaka'ako, those aren't 24-hour ambulances. Those are 12-hour ambulances to give us maybe peak time coverage. Because, when you look at our 911 board at 2 in the afternoon, we may have 30 requests for EMS services at 2 in the afternoon, but at 2 in the morning, we might only have 4 or 5. So one of the ideas is rather than having 21 or 22 24-hour ambulances, let's stack up some extra ones during the peak times of the day to help offload that call volume.
I want to get and transition over to CORE as well. This is something that you have worked with the city with, is this new initiative in dealing with those who are homeless and those in need and those calls that come in there. What can you tell us about how things are going with the CORE program overall and just future efforts to expand on some of the services that are being outlined for this new department?
So CORE is with our department because they do so much medical work. And we found that in homelessness, it's so much more than just financial issues. It's mental health issues. It's substance abuse issues. People now we've seen there's that point in time found a higher percentage of elderly homeless. We find those folks a lot of have more medical issues, dementia. CORE's got around, the staff now is somewhere in the low 30s. We hope to get that up to 50. Half are community health workers who deal with social issues, social work type issues, and half are emergency medical technicians. We usually have about 2 to 3 ambulances on every day that are CORE ambulances. And these are hand-me-downs from EMS that are they're still licensed ambulances, but no longer kind of do we have them on frontline 911 service. I feel it's been successful, but we've also identified some needs that'll take it to the next level. And the biggest one is we need a place to take people that are sicker than can go to the shelters, but not sick enough for the hospital. And you'll see these folks laying out on the sidewalks and there's flies and they have open wounds. So we have now taken over the Ivole Resource Center. It's full of beds, it's full of equipment, and we hope within the next 1 to 3 weeks have that open for up to 25 homeless individuals to take there, stay there, ideally less than a month, but up to 3 months till we can get them placed in housing, nursing home, foster care to get them off the streets permanently. And someone, drove down King Street and was telling me about all the tents and the structures people have made. Those folks don't have the dire medical needs because if you can build that elaborate structure, you're still pretty able-bodied. The people I think really that need to go to this respite are the ones laying out open in the elements, laying in the sidewalks, maybe just a blanket over them. Very, very, very sad situations for these folks. So we're going to focus on them strongly over the next this summer. But at the same time, I think the mayor's initiatives in finding more affordable housing, more shelter space, especially in collaboration with the new governor and the expansion of the Kauhalis, I think really the stars are aligned for more success in homelessness than we've ever seen. The last few years were rough because everybody was focused on COVID. But again, now that COVID's mostly behind us, we really have an opportunity to be very successful in an area that's been very challenging. And I tell people, if homelessness was easy, it would have been taken care of already. And this isn't unique to Honolulu. There's homelessness in every major city across the country. But I think some of the things we're doing here are novel. And my thought is other cities are going to copy us once we have this a little more streamlined and can show the successes that we think CORE is capable of.
So forgive me because I'm not familiar with this respite center. So can you give us a little more detail as to who's staffing it? Is it the responsibility of the city? Is there a third party that's contracted, maybe a nonprofit, or is this something that EMS is staffing?
So the Evelay Resource Center is a city building. It was completed and had been empty for the homeless. And there were some different models to have different nonprofits run it. And those are still being discussed. But at the end of the day, it wasn't being used. It's a brand new city building for homelessness. And the CORE team said that we can get this open. And I took that to the mayor and he agreed. And so the CORE team has, we've gotten 25 hospital beds donated from Queens and Wahiawa General. And we have the staff in place, and CORE is going to run it. Now, long term, that building probably will not be run by CORE forever. We hope to have a nonprofit taking it over, or perhaps the state. We've been having weekly meetings with both our housing team at the city as well as state DOH and the mental health folks. But we're trying to get it open for this immediate need of the most vulnerable homeless, literally like probably in the next couple of weeks. But once that's open, if it's successful, then we need to look at that model for other parts of the island, West Oahu, Central Oahu. So, check back with us in a month, but I think we'll be able to share a lot more on what we're doing once we get it open. And it will work in collaboration, I think, with the governor's own plans for his various small house kauhalis, which can include also an element of medical respite. And when we say medical respite, these are folks who need medical care. So CORE does have a part-time doctor. We have 2 part-time nurses. We also are partnering with the home program from the medical school, where medical students supervised by physician faculty at the med school are also helping to care for these patients. And at the end of the day, we're not only are we getting them off the streets, but we're preventing them from overstaying in the hospital when they really don't need to be there.
Well, unfortunately, we are almost out of time. But before we go, we just wanted to let you have a final statement or final comment here as we celebrate EMS and recognize all that you and your department does for our community. What is your message for viewers and just generally anything that you would like to share or anything that they should know about EMS, about your services, and just some final thoughts?
Well, my first thought is, where does the time go? And I could sit here for 12 hours and tell you all the good works of EMS, and CORE, and Ocean Safety, and Health Services, which are all part of our department. But just know that all our paramedics, EMTs, and our dispatchers are working very hard for everyone in the community. They have very high standards. They treat our patients like they would their own family members. And you're in really good hands when a city ambulance shows up. These folks are all highly trained. They're dedicated. They love their jobs. And again, I just couldn't be more proud and humbled to be affiliated with such great people.
We appreciate all that you and your entire team does for our community. Dr. Jim Ireland, thank you so much for being here this morning.
Thank you.
Aloha.
Very interesting to hear all that he shared with us this morning, Ryan, talking about the men and women of that department and all that they do. They are facing some significant staffing challenges, but he said that they hope to have a robust staff with a new class that is going through KCC right now, or actually starting in July, forgive me. And then hopefully at the end of the year, having those staff folks brought on. In the meantime, he said they are 20% higher in their call volume compared to pre-COVID. And that is because of a myriad of issues. He says delayed healthcare, perhaps during the pandemic, and also some troubling statistics he shared with us and information about the number of self-harm calls that they are getting and also drug overdoses.
Yeah, you heard those numbers from him as they began to look deeper into some of those numbers. Again, saying he's not sure really why, but really urged the mental health community to look into some of these issues that they're seeing with overdoses with pills that he says. But there has also been some of those unfortunate incidences with, these illegal substances that have led to further damage, of course, for the community. Fentanyl that we've discussed on this program with drug experts and its presence in the island, certainly something that the EMS team is also seeing here on the ground. And luckily, there is that Narcan that can help to remedy some of those overdoses. But also, as he mentioned, there could be something passed through the city council that would require bars and other establishments to have Narcan. So we'll continue to follow up on that, but also just hearing about the volume and the way that they are looking to stagger some of their ambulances and their services moving forward in order to accommodate some of the biggest needs, which surprisingly, he said, at 2 o'clock in the afternoon, there could be up to 30 calls. And that just seems like an alarming number for this, and a lot of stress that must be on this staff and this resource.
Yeah, there are significant budget challenges, of course, to try to staff that up. He says, realistically, the department needs at least another 5 ambulances. They're hoping for 1 to 2 a year, or for the next 5 years, more than 5 rather, because there are 22 now. He wants to get to 30. In the short term, he's hoping that the mayor's budget will include what they've asked for, which is another rig in Kalihi and one in Kaka'ako on that staggered schedule, as you mentioned, perhaps a 12-hour shift, just to alleviate some of that backlog. Another thing that he hopes is alleviating some of that backlog is the CORE program, which EMS is also responsible for. And very interesting to hear about this medical respite center that they are hoping to staff up and open within the next month.
Yeah, and that Iwilei facility, really hoping to provide that care between being in the hospital, but not necessarily just being in a shelter, and providing, being able to provide some sort of medical assistance to those individuals who still need that. And so we'll continue to see how that pans out in that facility over time. He says he doesn't believe that that will be a permanent home for CORE and these types of services, but there certainly is a need. And you can hear, you've heard from him about how they also see how some of the governor's plans for his kauhales and these medical respites may also fit into the CORE's plan. So a lot of collaboration there happening between the city and state. And speaking of the governor, he will be here on Friday. We'll, of course, talk to him about the kauhales. Of course, this is an initiative that the governor has been advocating for since his time as lieutenant governor, and really making it a part of this administration as he continues to move forward now that the session is over.
Yeah, we have so much to talk to him about when it comes to session, any possible vetoes on the horizon, how he thinks it all went and what he's looking forward to. And of course, those kauhale, he did say that he wants about 24 over the next few years throughout the state. Where should those go? That is going to be a big conversation. So we'll be asking him about that. Again, we want to thank the men and women of EMS for all that they do for our community, and really champion them and thank them for all that they contribute. So happy EMS week to them, as Dr. Ireland noted. Every week is EMS week for them, and we really appreciate them. And join us right back here Friday. We've got the governor, and we're sure that we have a lot of questions. We know you do too.
We'll see you then. Aloha.